Well, good afternoon, everyone. My name is Ellen Hahn, and I'm the director of the University of Kentucky Center for Appalachian Research and Environmental Sciences. And we are so excited that you're here to join us today in our very first zoominar. We originally had invited Dr. Korfmacher to join us in person in the Big Sandy region. We do want to thank the Big Sandy Community and Technical College as co-sponsors with us for this zoominar, and along with the UK Center for Excellence in Rural Health. In addition to the UK faculty, staff, and trainees, and other college and university partners around the state and the region, we're so pleased today to welcome community partners from local health departments, government, coalitions, nonprofits, all interested in either environmental health, health disparities, and behavioral health. You're in for a treat today. Dr. Katrina Smith Korfmacher is Associate Professor of Environmental Medicine at the University of Rochester Environmental Health Sciences Center, where she directs the Community Engagement Corps. Her community engaged research and outreach is embedded in her community of Rochester, New York. She's an active member of the Rochester Healthy Homes Partnership and the Water Education Collaborative, as well as several others. Okay, I'm just going to move by. We do have some new people with us today. So I wanted just to give you a little context about our center. We are one of 21 other environmental health sciences core centers in the United States, including the University of Rochester. UK Cares connects researchers with community members who are concerned about the air they breathe and the water they drink, as well as other environmental concerns. And you can see Dr. Korfmacher down on the right-hand side talking to Dr. Erin Haynes from UK at a recent meeting in North Carolina. So we do a lot of cross-collaboration, and we're thrilled that she could be here with us today. Okay, let's see if I can, here we go. So this zoominar is a series, one of a series of free monthly environmental health science webinars. So please visit our webpage for information about upcoming opportunities. For those of you who are faculty at UK and community technical colleges in Southeast Kentucky or high schools in the region, we do have a call for nominations for the UK Cares Fellows in Science Communication program. So check out our website for more information. That deadline's actually Monday, so don't miss it. All right, so today, as I mentioned, Dr. Korfmacher will share with us ways that communities can collaborate across systems and sectors to address environmental health disparities. As in her book, I know she will share several findings from case studies related to childhood lead poisoning in Rochester, New York, unhealthy environments in Duluth, Minnesota, and hopefully pollution in Southern California. I just wanted to share with you a person who endorsed her book, Bridging Silos, Gina McCarthy, who's a former US EPA administrator. She said, Bridging Silos offers hope at a time of federal inaction on pressing environmental and public health issues. Through practical examples, Dr. Korfmacher shows that by listening to the most vulnerable voices, working across political and bureaucratic boundaries, and designing systemic solutions, our local communities can keep our country moving forward. So the good news is the first 25 people who registered for and attended the zoominar today will be eligible to receive a free hard copy of Dr. Korfmacher's book. Those eligible will be notified by Monday via email so that we can get your address and send it to you. If you do not win a book, though, the good news also is that you can download a free copy at MIT Press. So at this point in time, I just want to remind you that you will be muted. Please use the chat box to enter your questions or comments. So I will turn it over to Dr. Korfmacher. Thank you, Katrina.
Great. Well, thank you for that very kind introduction, Dr. Han, and I really appreciate this opportunity to be your first zoominar guest, and I'm very sad that I'm not there in the region in person. I was really looking forward to being able to visit you, but being able to zoom in is, a nice opportunity. Um, I just wanted to let you know that we'll be collecting questions through the chat throughout. I can't actually see the chat as I'm presenting, but we'll make sure to leave plenty of time for your questions at the end. So thanks for that. And I also wanted to say that it's a really great opportunity for me to be able to talk with you about what's in this book, because it is focused, the title of the book has urban communities in there, and it is focused on 3 case studies from urban areas. And I really thought carefully when I was writing this about whether I wanted to mix some urban and rural cases, but decided that there really are some fundamental differences. I think is a lot of cross-learning that can happen between different kinds of communities, but there are also some differences. So this webinar and your questions will give me a chance to start thinking about that. So I was originally trained in ecosystem management. My first job was as a comprehensive planner in towns between 300 and 1,200 population size. And I was trained at a marine lab with a population of about 65, if you didn't include the dolphins. I've been focusing for the last 20 years or so on environmental health in urban environmental situations, but I'm really looking forward to a chance to talk with you about some of the similarities and differences in those situations. So I just want to spend a couple minutes laying out the premise of the book project that I'm talking about before I launch into the case studies, which I think are really the meat of it, and focus on the question that I was really interested in exploring, which is how can we promote an equitably healthy environment when health and environment are managed separately? And starting by thinking about the fact that historically public health and environmental health were the same thing, but now we really manage those separately. And as I think about the kinds of environmental justice cases that we read about and think about, and the kinds of environmental health harms facing communities, they can almost always be traced to a gap between how we protect the environment and how we think about people's health. And looking around the country, there are a lot of local collaborations that are working to try to address those environmental injustices by bridging the way we think about and the way we manage environment and health. So I just want to dig into those 3 points a little bit farther. As the premise of the book that, as Dr. Han said, came out in the fall. And I also want to highlight, if you are not one of those first 25, there's an amazing program funded through the MIT Press libraries where they got donations to make the book open access. So as a consolation prize, you can go on their website and download the whole thing for free. It doesn't have the pretty yellow cover though. So the premise is that these local collaborations to address environmental justice are happening all over the country. And I really thought about that because, as Dr. Han said, we have centers in 20 or 21 different places. And as we get together and share our work, we realize, we see these same sorts of amazing things happening as we bring together scientists, community members, and decision makers in many different places. And those efforts are extremely diverse in the kinds of issues they address, how large they are, how they're structured, how they go about their work. But many of them have really made some impressive successes in changing policy in ways that promote better environmental health and equity going forward. That said, because they happen in different areas and have to do with different topics, there isn't a lot of cross-learning between them. So I thought the best way to try to promote that was to bring together some very diverse, in-depth case studies in this book to try to ask the question of how can we better support these local environmental health initiatives going forward in more places. So I start the book out by talking about Hurricane Katrina. And a lot of people have said a lot of things about Hurricane Katrina and its implications for environmental health and justice. But since they used my name and it gets taken in vain and I can't go to New Orleans anymore without people, cringing whenever I introduce myself, I figure I got to be one more person who started with this story. I also, for a long time, had this quote from a newspaper posted above my desk, which is, "Katrina has made it clear who the government works for and who it does not." I realized sort of after the fact that this is kind of a byline for this book as well. By looking at what happened after Hurricane Katrina, we certainly saw a lot of injustices in how the government responded to that situation. But looking deeper into why it was that low-income communities and people of color had the most severe health impacts and long-term damages from this hurricane, you could see it was because of decisions that had been made over decades having to do with housing, health, transportation, neighborhood planning, so that people really were at risk on a systematic basis as a function of their socioeconomic status. So this makes it seems like common sense, and in fact, this idea that the environment and health are closely connected goes back centuries. So if you don't recognize this cartoon, I will say that pretty much every public health class starts out with the story of John Snow and the cholera epidemic in London in the mid-1800s, and that he mapped the cases of cholera and found that they were concentrated around the Broad Street pump. So there was this one source of water that was contaminated, and he recommended taking the handle off that pump, and when that happened, the cholera epidemic receded. And to this day, the pump handle is sort of the iconic symbol of public health. That's like what the public health newsletter is called. So this was really the origins of public health. It was environmental health. But as we moved forward and those disciplines developed, public health developed in a separate silo, completely different management structures than environmental management. So in the area of water treatment, for example, engineers and sanitarians developed technical skills at how to keep our water clean, how to keep wastewater separate, how to manage garbage and air. And that silo of expertise was not connected to the people who were thinking about vaccination and healthcare and the public health side of things. So that's where I came up with the idea of talking about these two silos and the need to bridge them. Now, public health has increasingly recognized this problem, and you've probably heard the phrase, your zip code might determine your life expectancy, right? Your health is determined by your zip code. And there have been maps in the media. This on the left is from Time magazine showing around Chicago how the life expectancy by neighborhood varies extremely over a very short distance. So public health gets that the environment is shaping people's health, so much so that lifespan is determined by where you live. But they don't necessarily have good tools to act on that. Now, kind of ironically, international global health has understood this for a very long time. And on the right is an infographic from the World Health Organization showing all the different ways that environmental factors contribute to health. Now, I mentioned that I was trained in ecosystem management. So where I go to with this dilemma of these two silos of managing environment and public health separately is, what if we thought about public health like we think about ecosystems, right? So the thing about working in public health is you just don't have the kind of pretty pictures that we do in ecosystem management. But if you think about Yellowstone and bison, if you want to protect the bison, you need to protect the water source that feeds the grass that they feed on, the air around them, and the entire ecosystem. People in ecosystem management have understood this for a long time, that different sectors, the people who manage the air, the agencies that manage the water, the foresters, the park managers, the wildlife biologists, all need to work together if you want to have a healthy bison population. So if we think about that same kind of framework for public health, it really does require promoting collaboration between different kinds of management systems. Now, this is pretty difficult to do at the national level because we have federal bureaucracies and agencies that are really designed to work efficiently separately. But the local level, we can see on a kind of common sense basis how this doesn't work, how it results in problems for local communities. And we also have the opportunities, because we live and work together so regularly, to start bridging those silos and making some connections. So to develop that idea, I looked for 3 case studies that I thought represented some pretty different areas and different kinds of issues that if we compared them, we might be able to learn something about how to promote these kinds of local collaborations in other areas. So the 3 case studies are looking at Rochester, New York's Coalition to Prevent Lead Poisoning, and its focus was on reducing hazards in older low-income rental housing. In Duluth, Minnesota, where the focus was promoting an equitably healthy built environment with a particular focus on food access and transportation equity. And then the third is the ports of Los Angeles and Long Beach, and thinking about the health implications of all of the different aspects of moving goods into the ports of Los Angeles to be shipped all over the country. In order to compare these really different case studies, I developed a framework which is actually based on work that came out of ecosystem management and collaborative environmental management. It said, even though these are very diverse collaborations, each one of them had a set of collaborators, the who, so involving a mix of academic, community, government, and private sector actors. How, so they all had to identify an issue and frame that in terms of what the problem was they were trying to solve. They all needed to marshal resources to address that problem in a combination of human knowledge and financial resources from different sources. They needed to have processes and structures for collaborating and working together. So how to make decisions together, how to, and how the group itself was structured. And then what? So each of them had different kinds of outputs. They were all, and as you'll see in the case studies, they all were working in very different ways and had very different activities. But because the focus was on collaboration here, we had some expectation that the relationships formed and the capacity of the people who participated would be a really important outcome to keep an eye on. And then finally, their goals were to impact policies, systems, and environments in ways that could sustainably address the root causes of the problems that they were dealing with. So I'm going to just spend 5 or 6 minutes telling you about each of these case studies, and please do interrupt me if there's a point of clarification that you have about each one of them. Rochester is near and dear to my heart because this is where I've lived for 20 years. One of the things that you may not know about Rochester is it's a very old city, and most of its housing was built before 1940 and 1950. Some of that housing is in really good condition, like that house to the left, and some of it's in pretty bad condition, like the house to the right. So that house's assessed value is about $30,000. And all of these houses have lead paint on them. And this is what lead poisoning looked like in Rochester. So a lot of older windows and peeling paint and lead contaminated soil, which because we have so much snow is often bare and children play in it. They get that lead into their bodies and they become lead poisoned. So the map to the right looks just like the map of low educational attainment and poverty in Rochester, but it's actually a map of lead poisoning rates. And the red and pink areas being areas with 25, 30, 35% of the kids having elevated blood lead levels. And that's blood lead levels over 10 micrograms per deciliter back in 2002. So I'm going to take you back in time a little bit to when this case started. One elementary school principal heard about lead and looked up the records of all the kids coming into his school and found that 41% of them had a history of lead poisoning. So he was an elementary school principal. He had nothing to do with the health system, housing systems, legal systems, but he was so concerned about the effects of lead on the kids coming into his schools that he started reaching out to everyone he could think of to say, hey, this is a problem. What can we do about it? And digging in, the health department and the Coalition to Prevent Lead Poisoning that resulted from his work found that Rochester's lead poisoning rate was 10 times the national rate. And this wasn't because our health department was falling down on the job. In fact, its program of secondary prevention, finding kids who have elevated blood lead levels, going to their houses, making sure that their houses get fixed, was one of the strongest in the state. But that didn't prevent additional kids from getting poisoned. So the coalition really focused on, we need to change systems, we need to change policies to look at houses before kids get poisoned, and we want to make sure that we do this in a very science-based way. So coalition essentially reframed this problem as one that was a health problem, that was the responsibility of the health department, to be a housing problem, and one that we needed to work to find a housing solution. The coalition had a very comprehensive communications campaign to reach out to community leaders and different interest groups to show them how their interests related to lead. And this culminated in a community-led summit in 2004 and brought almost 500 people together to express their commitment to ending lead poisoning. There was also a really strong science committee to vet all of the ideas and reports and policy proposals of the group. Not a lot of new research was done. A very small pilot study called Get the Lead Out sort of affirmed that the lead trends in Rochester were similar to elsewhere. And this was all used to inform a local lead law that was passed in 2005. And it requires all rental units to be inspected before people move in. And since that time, over 160,000 inspections have been completed. So every house gets inspected, every rental, every 3 to 6 years. And you can see on the right what this has done to the number of children with lead poisoning in the city. It's a huge decline. And I'd like to point out also that everywhere lead rates are coming down, but our lead rates have come down 2.5 times faster than anywhere else in upstate New York. So this coalition, you can see us in City Hall celebrating the 10th anniversary of the lead law passing, has served as a model for other local initiatives having to do with child obesity, asthma, and other kinds of issues, because this was seen as such a successful and innovative way of crossing boundaries between different kinds of organizations. And the coalition has stayed involved, making sure that lead law is working, sustaining support for it, and increasingly advising other cities on their lead problems. So I'm going to take you across the country now to Duluth, Minnesota, the second case study. And Duluth is on the far western edge of Lake Superior. It's a really cold place, even compared to Rochester. This picture on the left was taken on March 21st. It was snowing really hard, so hard that the schools were closed. But this is a guy surfing in the water of Duluth. And that makes the point that these are really intrepid people who love to be outdoors. So this place is really well known for having an active trails system. And it's redeveloped around this idea of recreation. But you may not know from seeing that today that in 1986, Duluth had the highest unemployment rate, one of the highest employment rates in the entire country. And that's because its economy was based on U.S. Steel, which had closed. And so, we think of lots of Rust Belt cities that suffered in this time, but Duluth was so dependent on those industries that it really, there are neighborhoods that lost 50% of their population. So it has been redeveloping recently as a center for healthcare in the region and a gateway to recreational opportunities. But people working there said, the tide is not lifting all boats. We are improving, but low-income people living in higher poverty neighborhoods aren't doing very well. And guess what? They also have worse health outcomes. So this story starts with a volunteer, someone who was really passionate about promoting healthy lifestyles, Mimi Stedner. She's in the middle there. And she helped establish this program called Fit City Duluth, which was focused on promoting healthy lifestyles. And her effort sort of was one of several that it broadly called Healthy Duluth. And I really want to make the point that this work evolved in many different sectors, because it's not like they had to wait for or had a single organization with good funding in one place. There were a lot of related efforts that sort of complemented each other over time. And since this is the smallest city and it does have a rural component, I wanted to highlight that because it is an example of how they managed to do quite a lot with relatively limited infrastructure. So Fit City was a governor's designation. It was focused on promoting healthy living. And as part of that, the group learned about Pioneering Healthy Communities, which was a CDC conference to focus on how communities could promote healthier environments. And a team from Duluth went there and were gobsmacked by the things going on in other communities. They really were impressed by how other communities were changing policies in order to promote healthier environments. So that after that conference, they really became focused on systems change. So what could they do, not just to build one more trail or address one problem, but change the way decisions were made, more systematically to promote an equitable health and healthy built environment. So with that focus on policy, Fit City transitioned to a different organizational host, the Zeitgeist Center for Arts and Culture. I emphasize that because that probably doesn't seem like a natural hub for environmental health activity, but that was their main community action and nonprofit, and that gave a home to the Healthy Duluth Area Coalition. So basically it was just a coordinating, convening forum for these different groups to get together and focus on how to coordinate their efforts around fair food access and active and equitable transportation. They also benefited from the state of Minnesota's active promotion of health impact assessment. So the Minnesota Department of Health recognized that with all of their rural communities throughout the state, they needed to help all of these separate communities act themselves to promote healthier lifestyles and built environments. So they got grants to do health impact assessments in partnership with a couple of municipalities to build local capacity to connect decisions about the built environment and health. And they did 3 HIAs in Duluth around a street redesign and 2 small area plans in Lincoln Park and Gary New Duluth, which were both very low income neighborhoods. So at the same time, there was work going on in the city's economic development branch having to do with brownfields. Now, as I described, this small city had a very strong industrial history, and it's just basically the city is just a sliver of land between the lake and sort of a steep cliff. So any new development pretty much has to take place on something that was formerly industrial land and possibly contaminated. So they were very active in getting brownfields cleanup grants to identify, what limitations there were, how they could subsidize development of these formerly industrial properties. Now, interestingly, the US EPA gives extra credit on their applications if you can make a case of a positive public health outcome. And so the people writing these grants were like, well, how could we do that? And it really pushed them to think about the public health impacts of the brownfields redevelopment. So the example that I'm showing you here is where they took a former factory site and developed as an ice skating rink, a children's museum, and sort of re-envisioned this whole neighborhood as healthy and active sports activities surrounded by a lower income neighborhood. They also at the same time said, the trails and the mountain biking in Duluth are great, but what people need, low-income people need, is help getting to their jobs, to grocery stores, and in the process, getting physical activity. So they prioritized their bike trails so that they could provide a transportation resource for lower income neighborhoods by focusing on those segments first. They scheduled a special grocery bus to go from lower income neighborhoods that now originally took 2 buses and 30 minutes to get to a grocery store to go point to point, and had a special place to put the bags. They had tactical urbanism projects where they would take over parking spaces downtown and just show what it would be like if there was less parking and less car travel there. And we continued to engage in street redesign projects to make them more bike and pedestrian friendly. So all of these activities taken together really infused themselves in the decision making of Duluth, to the point that the new mayor, who was elected in 2016, said our right to a good and healthy life should not be determined by our zip code, right? She got it that the city should be planned in a way to support the health of all people. And she in fact said that as they revised their comprehensive plan, she was going to instruct the planning department to make health and fairness key goals of their comprehensive plan. So these efforts overall they didn't have a policy that said we're going to include health in all policies, but because they were infused in so many different areas of decision making, it really turned out to be a big factor in decisions going forward. So the last case study is out of Los Angeles. So you may know that nearly half of the goods imported to the US from China come in through the ports of Los Angeles and Long Beach. They don't just magically get put to our houses from there, though. They get unloaded from boats and put onto trucks to be taken to rail yards, or taken to trains that are then sent around the country and sent to other other transportation modes, and often are stored in warehouses in between. So this goods movement system has many different parts of it, but it was really thought of primarily as just, this is the economic engine of the ports of Los Angeles and Long Beach. But when Dr. Hahn and my colleagues at the University of Southern California hosted a town hall meeting in 2001, local community groups from that whole region who were touched by different parts of that system said, you know, these activities are having huge impacts on our community's health, but they're not thought of as a health issue at all. So particularly the air quality impacts were highlighted, but also noise, lighting, water pollution. And because these activities were expected to continue to grow, they said this is just going to become more and more of a problem of environmental health and justice for our communities. So our colleagues at the University of Southern California worked with them to help convene this project called the Impact Project, which first started by trying to work with community groups in several different neighborhoods around Los Angeles to say, how are these issues affecting you? How can we support you in your work? And ended up working with 4 of them and 2 different academic partners. So here are the 4 groups. They're from very different parts of the community. So the Long Beach Alliance for Children with Asthma, sort of down right by the ports, Coalition for Safe Environment in Wilmington, sort of western part of LA, East Yard Community for Environmental Justice, just along that highway, and then the Center for Community Action and Environmental Justice way out in San Bernardino, where there are lots of warehouses. So here's a map showing you where those groups are located. They engaged in a very wide range of efforts to try to affect this massive system. And in some ways, I think I just want to put a flag in the fact that because it was such a massive area and such a huge problem they were trying to address, is almost analogous to a rural situation where you have groups that are in isolated places working on different parts of similar problems. So what they did is they got funding that was shared between these partners, to form neighborhood assessment teams, and they trained local people to take air quality measures and count trucks, partly to collect that data, but also to help them learn and be able to speak with authority on the kinds of environmental impacts that were affecting the health of their families and neighbors. So they had forums to bring these people together and help them get comfortable talking in public settings, at hearings and in meetings, and also capturing their stories in videos and other ways that could be shared with a wide range of audiences. They also produced a wide range of policy briefs because they were trying to affect policy at a pretty large scale. And they realized that these issues were not just an issue around these ports, but around port communities throughout the country. So they started bringing together national conferences to share strategies and approaches in different port communities. As a result of all these activities, the academic partners emphasized that they learned a lot, that they deepened their understanding of the community issues and the needs that they could address. They also increased the environmental justice groups who were participants' ability to engage in policy by helping them own the science and understand how to talk about it in public settings. They had a huge range of outreach and education materials that could then be leveraged and used by those groups in their independent work, and also mobilizing individual residents so that on both a national scale, state scale, and in terms of local plans and decisions, they were able to get involved in policy making. So some of their most significant work was fighting the expansion of the I-710. It's this big highway that goes from the ports up towards up north, and trying to figure out ways to do that were not going to increase damage to the health of the adjacent neighborhoods. And also realizing that some of the issues that they identified at this local level really required state or national solutions. So they also engaged at the national level by forming these national coalitions and spawning this moving forward network to take on some of the federal policy changes that were needed. So overall, they had a wide range of accomplishments. You can't point to a single project that they blocked or created or changed, but overall, the whole goods movement, growth of the goods movement industry is now viewed as a health issue in this area. So it really affected in a very deep way how these decisions are made. So I'd like to close by just, presenting some of the things I think are common and different among these, and then open it up for discussion. I started out with this framework of the who, how, and the what, and and I'm going to talk a little bit about how those cut across the cases. So just through cases, but in each one, there was a very different mix of academic, community, government, and private sectors. I think you may have noticed that the convening group, sort of the core, was different in each of these cases. So in Rochester, there was really a community hub. In Duluth, government co-convening was really important. And USC, an academic institution in Los Angeles, was the hub there. So it's not like there's one magic recipe that's needed. It's different in each place. But also in each place, the issue was initiated by someone who was not part of the existing management system. And I think that's interesting because they sort of called the question, the way we do things now just doesn't make sense. And it wasn't their job to fix it, but then they reached out to insiders, people who were in health and in environment, to work together to try to address that. They also worked at a local level, but tapped into help from outsiders, people from across the country. They also worked with their local communities. And I want to point out that that doesn't mean that residents were directly involved in each one of these groups. And some of them, their involvement was indirect, but each one of those efforts really emphasized the importance of community input in whatever mode they could manage it. They had a wide range of targets for system change, and it's important to note that that target is often a government agency, right? Because it's the way things are done now that they were trying to change. And all those government agencies were often part of the effort. They were never the leader or the convener. They all managed to reframe the issue they were looking at. So ironically, in each of these cases, the core health issue was actually getting better. Lead had been recognized for a really long time. Everyone knows that air quality in Los Angeles is awful. Duluth's environment was a mess after US Steel left. But these things had all actually improved. And what seemed to get the energy to do something about it was focusing on equity and how those effects were really unfairly borne by certain communities. Each of these groups did not generate a lot of new research or new information, but they were very effective in integrating and applying information that was already out there, but stored in these separate silos, so it wasn't being used together. Each one of them obtained resources very differently. So none of them had like a single core funder and organization, but they were very entrepreneurial in pulling together funding from different sources. It was always hardest to get support for the convening function, but they were very resourceful in finding funding to sort of keep the efforts going. Many of them leveraged human resources more than financial resources. So the Impact Project did have some significant grant funding, but compared to the scale of the problems they worked on, these efforts were really relatively low in terms of dedicated cash. And the other thing they used was bringing together all these people, leveraged huge amounts of knowledge, whether it was knowledge about the community, knowledge about health, or knowledge about the environment. And that built up their credibility and their ability to be really impactful. I also wanted to emphasize that their structure varied very much. Only one of them, actually, none of them had their own 501c3. They were all hosted by someone else. I think that's important because a lot of times we look at a problem and we want to solve it and we say, we need to form a new organization. And in fact, none of these initiatives were a formal organization. As I've described in the case studies, what they produced was very diverse, but in each case, the social outputs were essential to the kinds of long-term impacts they had. So both developing the capacity of the people who participated, but especially the relationships that were developed between the people who worked on them. As I mentioned in the lead case, this meant that even though they had a single initial target, they ended up having effects in lots of different areas. They also had a lot of exchange between the local and outside of local efforts so that they were sharing lessons broadly. Each one did also have impacts on policies, systems, environments. None of them could say, well, the possible exception of Rochester and lead, it's very difficult to say this health impact has been changed because of this collaborative effort. But they all changed how decisions are made, which bodes really well for them having impacts going into the future. So I think I'm going to close by leaving these common themes up as a basis for questions. You'll see that my last slide has all the ways you can get access to more information about this. And Dr. Hahn, I really appreciate you starting with my favorite quote with, with Gina McCarthy talking about how important these kinds of local activities are at a time when we can't necessarily count on the federal government. I was particularly pleased when I did a webinar on the book for the US EPA, and the division chief who was introducing me used that quote. Thought that was very brave of him. So anyway, my closing thoughts are that health equity is a very powerful idea to bring into environmental issues. So again, these are longstanding issues, but focusing on the health inequities that were tied to them made a big impact. Collaboration is a process, not an organization. Often this happened informally between individuals, just focusing on the level of organization that was needed to achieve their goal. Many different kinds of groups can serve as conveners, including an arts organization in Duluth. Boundary spanners, the people who actually do this work, many of the individuals involved had never collaborated outside of their organization before, but they said it was so clear to them that by doing so, they could achieve their goals in ways they hadn't before, that they took that plunge and started working collaboratively. Also, you know, I'm in an academic institution, so this may not be popular to say, but the research can be helpful, but the translation was really the most important part of in each of these. Another is that locals are listening. I was really, you know, oftentimes I'm working at the national level and seeing the kinds of programs that are trying to promote environmental justice work at the local level, and to see how each of these groups was strategically taking advantage of national opportunities like that to enhance what they were trying to do locally was much more of a bottoms-up process than you might have thought. I also wanted to highlight that, you know, we always need to think about what we're measuring. Very difficult to, as I said, to see impacts on health. And so looking at environmental impacts, but also impacts on process is important. And the fact that each of these local initiatives can be connected with a national impact, I think is also really promising. So I've managed to give us 15 minutes for questions. I'm really looking forward to hearing them. Thank you.
Thank you, Katrina. That was awesome. I knew it would be. We do have quite a few questions, and I'll start out with Dr. Unrein's, Jason Unrein's question, and it kind of ties into another question about research. And so he said the case studies that you mentioned mostly focused on human health. What are your thoughts on the complete siloing of human health and ecosystem health research funding and regulation? This is largely entrenched in the structure of our laws, but are there ways to link these areas? And then Dr. Huntington Moskis from U of L answered him kind of and put this on the table that NIEHS does discuss and fund work related to the One Health movement that kind of begins to address human health and ecosystems. So that's a big mouthful, but basically the question is about the siloing in the research endeavor.
Yeah. Mm-hmm. Oh, I love that question. And, you know, what my sort of research passion is on how science gets used to inform decisions, particularly when there are communities. And when you look at public health as an ecosystem, it's really essential to connect those things. Unfortunately, yeah, the way we've set up our funding structures is not really conducive to that. And I guess I'd suggest that, you know, again, starting at the local level where you do see initiatives like these that are tapping both health funding and environmental funding, and kind of leveraging the fact that both sides of that get that crossing those silos is essential. So what do I mean by that? I think that particularly when I look at my environmental ecosystem management listservs and funding opportunities, they get that doing work that has impacts and you can show impacts on human health raises up their enthusiasm and support for their work. I think that that is strategically, you know, important and is encouraging that kind of work. From the other side, yeah, health funders are increasingly understanding the environmental impacts, but there still is a huge gap. And you know, the area of exposure science and trying to really integrate those things, I do think is an underfunded and a big challenge going forward.
Thank you. Katrina, we have another question about educating lawmakers or legislators. Given the enormous impact of federal, state, and local policy on environmental health, whoops, somebody just, sorry. How do you work with individuals and community groups to engage, inform, and educate lawmakers?
You know, I think that I'll try to take an example from each of the cases, but in Los Angeles and Long Beach, one of their target audiences was local officials. So the impact project itself didn't involve governments, but it helped local elected officials who don't have that kind of access to technical support usually to understand the environmental health issues so they could be more effective advocates at the state and national level. So I think that, you know, trying to focus on increasing the capacity of local officials is a really important strategy. And then those local stories, of course, are very impactful on state level legislators and, of course, national representatives as well. So I think that the more we can do with local examples that are meaningful, especially, you know, when it comes from the district, people pay more attention, the more powerful that can be. But again, we don't always think about local officials as a target for this kind of work. And I think each of these cases showed how important that was.
I might just jump in and give voice to some of the groups we work with in Southeast Kentucky. And my observation is that local government is incredibly engaged and interested. Specifically, I'm thinking of the river, the Kentucky River that goes through Hazard, and that there's been an effort recently to, relatively recently, to build a kayak, or to buy some pretty inexpensive kayaks that people could then rent and use the river. And so, and that all really started by the government, local government. So I think in a lot of ways, government is definitely, at least in, I'm not saying in every community, but in some communities, Eastern Kentucky, that's been my observation, that you can do a lot at the local level that maybe you can't do at the state level. So I'm going to move to the next question. This has to do with gaining trust in the community and ultimately buy-in. So what's best practice in your experience for gaining community trust and ultimately the buy-in when advocating for environmental health policies?
Well, one of the things that I think is important to note is that each of these cases started with you know, trust and enthusiasm, at least at a certain level, because it was local groups that identified that problem. So, you know, I tend to look at things from the perspective of addressing the need and enthusiasm that already has been expressed and maybe broadening that a little bit. In the case of Rochester, one of the most effective strategies was, yes, the principal identified lead poisoning as a problem, but the community had identified that our failing city schools were a huge problem for the whole community. So that was able to translate the environmental health problem to something that a very wide swath of the community could get behind and sort of infuse lead into their existing agendas. And you see similar patterns, I think, in each of those case studies.
Awesome, thank you. We had a question from Bev DeLito at Marshall University. Hope you don't mind me calling you out, Bev. She wants to know, are there common characteristics of the most effective local partner groups kind of across those case studies? Or are there common characteristics of local groups that partner together to be effective, I think is what she means.
That's a great question. And my mind is racing. Well, if you do get access to the book, read chapter 8, because I think that's probably the best answer to that. And I would say that each one of these cases did have some resources and a little bit of capacity initially. And I call this my stone soup theory of community change. That I described none of these as not particularly well resourced in comparison to the overall scale of the problem, but they did have something, right? So I don't want people to get the impression that we don't need to worry about things at the national level or the state level, and we don't, because things just magically will happen at the local level. In truth, each one of these communities had something going for them. And it's, you know, the story of stone soup, that, you know, all the woodland creatures were hungry and nobody had a lot, but somebody put a stone into the pot, and then someone else had some carrots and someone else had some potatoes. And pretty soon you had this really nice stew going. And that really is what happened there. So the stone is generally some capacity for convening. And in Los Angeles, and frankly in Rochester as well, the fact that there was someone, a Dr. Hahn, who's funded and whose job is to create and sustain partnerships, made a big difference to being able to keep that soup simmering over a long period of time. In Duluth, it actually was more the local health department, and to some extent the city, because the Minnesota Department of Health had put that on local health departments, said, part of your job is to form and sustain local partnerships. So someone was getting paid to create a partnership. It just wasn't magic. And that's kind of a long answer to your question, but I think that the success is that, yes, there was a match between a need and enthusiasm, but there also was this little bit of capacity to sort of fan those flames and bring together all those resources in a way that was highly productive. So huge leveraging factor, right? But they needed to start with something. And the flip side of that is that I do worry that this can lead to greater disparities between communities that have those kinds of resources and those that don't even have enough to get off the ground. I'm really interested in, you know, how can you identify and help those places? Because you know, funders are always looking for someone who has a great collaborative, or, you know, some great infrastructure that they can build on, because they know that's going to make them look really good. Los Angeles has incredible richness of environmental justice groups, but a lot of places don't, and we don't hear their stories. Yes, the having some capacity is a sign that, you know, a common feature of them having success. But that's what worries me, is that we do need to take lessons from these places that have been able to innovate and share them up in terms of state and federal infrastructure, so everybody can benefit from them.
Yeah, great. The last question I have here, and we do have a few minutes, so if you have a question, feel free to type it in the chat box. This has to do, it kind of fits with what you were just saying in terms of health equity. How do we give voice, you know, to people who feel like they aren't powerful and that people won't listen to them? And I guess I feel people who are disparate populations who maybe aren't connected, right? And that was the power of all those 3 case studies. But I guess, you know, at the sake of sounding cliche, I guess some people talk about apathy, and that people want to see change, but they don't necessarily feel like their voice is going to be heard. So can you just talk a little bit about that? If you saw any common themes across those 3 case studies or in your work about giving voice to people who feel like they aren't powerful enough?
Yeah. I think that the Los Angeles group did that most intentionally by getting funding to be able to give stipends to local people to create some of their own science, right? And to make stories out of their own knowledge, and then intentionally gave them trainings and opportunities to share that in public forums. And many of those individuals just, you know, that they took off from there, right? They had that experience and they were able to leverage that in other areas and other settings. And sometimes I can be a little impatient, think like, you know, having somebody count the trucks in front of their house, how's that gonna make a difference? But if you really look long-term at the kinds of ripple effects that had on that individual and what they did in the future, starting with something as humble and simple as that, really can have powerful impacts. I guess in our case in Rochester, sort of similarly, we had a doctor who was just terrified to speak in public, and I was always encouraging him to, because just sharing the stories of his individual patients made such an impact on city council. And I think eventually he began to recognize that, and he went forward to every year giving lectures to medical classes about his experience, going from somebody who really just wanted to stay in the clinic and was terrified of public speaking,
to the really important role he had in advocacy and sharing that with students going forward.
Awesome. Thank you. Well, I have one question in the few minutes we have left. I was fascinated with the Duluth experience, hooking up with, I think it was the Center for Arts and Culture, I believe. We're starting to look at that. You know, Southeast Kentucky is just so replete with, you know, art and culture and so many different kinds. And so I'm just curious to know how that affected the Duluth experience, or were they just a pass-through? I couldn't tell in your discussion whether they were kind of like the place where the money passed through, but how did arts and culture kind of infuse itself into the campaign, if at all?
It's also a great question and complicated, and like everything in Duluth, just a little quirky. um, there was a local philanthropist who came into money he didn't even know he had, and he decided that was his passion, arts and culture, so he established the center to make everything Duluth better. So it was a center for arts and culture, but it had this very broad mission. And when these initiatives started in the city, and then it turns out if your goal is systems change and policy change, it can be a little uncomfortable to sit in the system you're trying to change. So they needed to move out of city government and find a home in the community. And you know, this happened in Rochester as well, is trying to find some place with that basically was willing to be the tent, right? And hopefully whose mission was complementary. So it was a convener. They did get grants, but through there, but the Center for Arts and Culture really did embrace that as part of their overall efforts to build community. And you know, they have a movie theater there. They would use that to have meetings with the health systems and, you know, show videos. So it really was very complementary. But again, it's a city. It has 86,000 people, but as a relatively small community, there weren't a lot of venues and places that they could be, versus Los Angeles, where, you know, groups like that are a dime a dozen. And so it just happened to be that was the best fit locally for the good of the community. And you know, I'd say wherever you go, see who's got the big room with the pot of coffee on that everybody can gather in.
Good. We do have one last question.
Awesome.
I think we'll have time. In your work, have you found that a structured framework, like a community forum or town hall, is helpful in collecting stakeholder and community input? Or does it have its disadvantages when it comes to disenfranchised populations? How do you accommodate for varying levels of community involvement? That's a really good question.
Oh my, yes it is. Yes it is. You know, I'm a bit cynical about, like, I was really cynical when we had this lead sign. I didn't think it was going to work, but it wasn't. But then the people who in the coalition who had experience organizing and much more experience with than me and policy change, like, this isn't about gathering input. This is about strategically elevating this issue. So they very intentionally went door to door to the synagogues, to the African American churches, to the Catholic diocese, and they knocked on the door and made sure that somebody from each of those communities was going to be there and stand up and say, we disagree, we may have different ideas of what God looks like, but we all agree that every child should go to school with everything that they were given. And they stood up together and shared that message. That was a very intentional aligning of community input in this broad forum. So it wasn't just a free-for-all town hall. It was designed with a purpose to make sure that voices were heard and that they had that opportunity and that they were going to be impactful. And in that kind of situation, I think it's really well worth it. But to your person's question, especially as we are all so busy and there are transportation challenges and people are holding down 3 jobs, I just don't think you can say that's legitimate, representative, meaningful input, but it doesn't mean you shouldn't do it. You just should be really clear on why.
Intentional. Well, I want to thank you, Katrina, for taking your time to share your wisdom and your experience and your wonderful book with us today. And I want to thank everyone for attending. I think this is a record. We typically have about 25 people on campus and we had about 60 people. So thank you. This was fabulous. We learned a lot. I just want to remind people to get on our website and check us out. We have another one of these in June. Dr. Carmen Marcet, who is the director of the Emory P30 Center, will be sharing his research. So have a wonderful afternoon, and thanks everyone.
Thanks so much. I've enjoyed my visit to Kentucky.
Come back
Take
when
care,
you
everyone.
visit.
That sounds good. Thanks, everyone.